family who struggles to provide food on their table daily, or anyone who became poor because of sickness, or a child with disability who has difficulty attending school. The Philippine Development Plan, Chapter 11, is about preventing these negative events from happening and ensuring that individuals and families have access to food and services that can help them adapt to life shocks. Ito ay tungkol sa pagtulong sa mga Pilipino upang matugunan nila ang iba't ibang pagsubok na dumarating sa kanilang buhay upang patuloy nilang makamit ang kanilang mga hinahangad. I'm Girlie Grace J. Casimiro Igtiben from the NEDA Social Development Staff. Join me in the next 15 minutes to discuss these plans and strategies. Dalawa sa mga vulnerability na nararanasan at nais malutas ay ang hunger at mga kalamidad o natural disasters. In 2015, 4 out of 20 or 21.6 Filipinos were poor. Compared ito to 3 out of 20 or 16.7% in 2018. Although bumaba ito, around 3 million Filipino households pa rin ay walang sapat na kita para sa kanilang pang-araw-araw na pangangailangan at nakararanas pa rin ng gutom. 39% of them experience moderate food insecurity o yung mga kulang ang pambili ng masustansya at high-quality food. On the other hand, 5% face severe food insecurity, or those who really experience na walang makain sa isang araw or even for a few days. Bukod dito, marami pa rin ang namamatay dahil sa kalamidad. Noong nakaraang taon, mayroong naitalang 142 deaths kaugnay ng mga dumadating na kalamidad sa ating bansa. In terms of social insurance naman, only about 2 out of 5 working individuals are covered by SSS. But what brings about hunger, deaths from disasters, and other vulnerabilities? What are the challenges that prevent Filipinos and their families in reaching their ambition? First, let's talk about natural disasters. Families living in hazardous areas suffer from the effects of typhoons, earthquakes, and volcanic eruptions. At ang mga kalamidad na ito ay maaaring maging sanhi ng pagkawala ng buhay at mga ari-arian na makakapagpigil din sa development ng mga tao at ng ating mga communities. While the COVID-19 and the measures we implemented to manage its spread, including mobility restrictions, disrupted work and supply chains in certain areas, will also affect the realization of our ambition. Dahil sa mababang income at delay sa delivery ng supplies, maraming pamilya ang nahihirapan na maka-access sa basic needs, katulad ng pagkain which can lead to hunger. Aside from shocks collectively experienced by the family, each family member also have their own concern. As an illustration, let us focus on the experience during the COVID-19 pandemic. For parents, many breadwinners got sick and were unable to work, while others are laid off due to business closures. Kapag nangyari ito, mababawasan din ang kita at resources ng pamilya. Also, ang pagkakasakit ng miyembro ng pamilya ay dagdag na gastusin. For children, when the family income decreases, spending on essential needs such as food and education are also compromised. Thus, some Filipino children may become malnourished, while others may opt out of school and engage in child labor for them to be able to augment their family's income. Ang ating mga kasama naman sa bahay na senior citizens ay apektado rin dahil sila ay vulnerable sa COVID-19. At the same time, kung mas mababa ang kita ng pamilya, maaring masacrifice ang kanilang mga health needs gaya ng gamot at check-ups. Mobility restrictions help manage the spread of disease. However, this may also increase the barriers faced by persons with disabilities in accessing services and also participating in socio-economic activities. At dahil restricted nga lumabas, nagiging mas vulnerable din ang ating mga kababaihan at kabataan sa domestic violence sa panahon ng pandemic. It is thus important to have programs that address the possible challenges faced by Filipinos across their life cycle. For example, job loss, calamity, aging, sickness, and more can be addressed by having a social protection floor. This social protection floor, or SPF, is a set of basic social security guarantees such that everyone can address needs at certain points in their lives. Through the SPF, kahit mawala ng hanap buhay, madisgrasya, o matamaan ng kalamidad o sakit, mayroon pa ring makukuhang serbisyo at benepisyo. In the interest of time, We will only highlight some of the components of the SPF. Through PhilHealth, all Filipinos will be able to access the needed health services. For example, if you experience critical pneumonia due to COVID-19, your hospital expenses will be deducted with as much as 780,000 pesos. Dahil mas mababawasan ng programa ang gastusin ng related sa healthcare, mas maiengganyo natin ang mga Pilipino na mag-avail ng health services. Also, due to the pandemic and the resulting economic contraction, there are many Filipinos who lost their jobs and their source of income. Through the SPF, individuals and families can be protected from income loss through the social insurance such as the SSS for the private sector and the GSIS for the government sector. Reaching out to workers to informal sector through programs such as the Alcansya, accreditation of co-ops as SSS collecting agents, and contribution subsidy schemes will ensure that more Filipinos are protected from income shocks. Dagdag pa rito, tutulungan natin ang mga Pilipino na makakuha ng maayos na trabaho sa pamamagitan ng trainings at job placement initiatives. We also put a lot of resources to ensure health and continuous education of Filipino children. The SPF includes programs which provide financial assistance through the Pantawid Pamilyang Pilipino Program or 4Ps, nutritious food through the school-based feeding programs, and employment support to families. These programs create incentives for poor families to send their children to school and commit to accessing the needed healthcare services. Such programs help end child labor in the country. Ang mga programang pang-edukasyon at kalusugan ay ang mga long-term investments upang maiangat ang buhay ng mahihirap na Pilipino at wakasan ang tinatawag natin na intergenerational poverty cycle o yung pagpasa-pasa ng kahirapan sa mga susunod na henerasyon. We would also help senior citizens to have healthy aging or matulungan silang manatiling malusog at sustained sa kanilang pagtanda. Through the SPF, we can ensure that the retirees and senior citizens receive regular pension to finance their daily needs. At sa pamamagitan ng programang ito, we can help our seniors live independent and healthy lives. Aside from the SPF, we also have other strategies that aim to help protect and empower Filipinos and their families. Certain population groups such as persons with disabilities, women, children are more vulnerable to shocks and risks. With social protection, gusto natin na ma-minimize ang kanilang vulnerabilities. Importanteng sila ay hindi laging dihado, kaya dapat mabigyan sila ng patas o level playing field. For instance, sa ating mga kapatid na may kapansanan, mahalaga na ang lahat ng stakeholders ay naiintindihan ang kanilang concern upang mabawasan ang anumang discrimination or violence against them at upang mapagsilbihan din sila ng mas maayos. Halimbawa, ang pagbibigay ng mga assistive devices at pati na rin ng mga support services ay makatutulong upang sila ay makasama sa ating gawaing pag-unlad. For women and children, one way to reduce their vulnerability is by ensuring the incidence of violence is reduced or eradicated. We will intensify our education campaign to end violence against women and children in the country. One of our important strategy for this is by integrating BAUC in the family development session of the 4Ps of the DSWD. Importante rin na ang bawat Pilipino ay may access sa masustansyang pagkain even during emergencies. We will implement a whole-of-nation approach that will ensure that people will always have access to nutritious food. Aside from strengthening the link of food consumers and producers, we will also encourage small-scale planting for consumption of the household and community. Sisiguraduhin din natin na ang mga nutrition program gaya ng supplemental feeding program ay mas accessible even and especially sa panahon ng emergencies. As a country prone to typhoons and other natural disasters, it is also important that all individuals and families and institutions are well equipped to manage these calamities. This includes savings mobilization, climate-proofing infrastructure, and enhancing coordination among disaster risk reduction and management actors. Sa pamamagitan nito, nais natin ng zero death sa panahon ng calamities. Our experience with the COVID-19 pandemic illustrates the need to improve the delivery of social protection services. Among others, the delivery of assistance, including the Social Amelioration Program, was delayed due to several factors. One, dahil sa limitasyon sa data, nahirapan tayong i-target at bigyan ng assistance ang mga tao. Second, dahil sa quarantines at hiwa-hiwalay ang ating mga isla or mahirap marating ang ibang lugar, nagkaroon tayo ng logistical problems. Third, stringent procedures of our local treasurers. And four, mahabang proseso ng pag-avail ng mga benefits katulad ng sa unemployment insurance. With these reasons, kaya sa ngayon ay fina-fast track natin ang implementation ng PhilSys o ng ating national ID at mailink at gawin itong interoperable sa listahanan ng DSWD. This should help in targeting and reaching beneficiaries. We will also work on the digital delivery of social protection programs to enhance their accessibility through ATM cards, cash cards, or mobile wallets like GCash and Paymaya. Through these programs, families will be able to provide food they need or prevent them from slipping into poverty due to any crisis. Nais din natin na ang mga ito ay makatulong na i-address ang disadvantages na hinaharap ng ating mga kababaihan, kabataan, at mga kababayan na may kapansanan. In summary, the Philippine Development Plan, Chapter 11, is about the government's assistance in minimizing the effects of risks so that amidst these challenges, the Filipinos can still continuously pursue their aspirations. Thank you very much.